Hi everyone, my name is Ryan and I'm a third year medical student, also future at Dr. Ryan on Instagram. And now that I work in the hospitals and that I have seen what the real world is like, I wanted to make a video about the differences and similarities between Grey's Anatomy and real life. So I've never watched the show before and I asked my followers what they wanted to know. So let's dive right into it. Are interns treated poorly? So honestly, I mean, okay, every case is going to be different. Surgery kind of has the stereotype of people being really cutthroat and kind of like serious and, you know, things like that. But from what I've seen, interns are treated pretty well. They do have to do a lot, but like that's a part of the job and like having to learn and stuff. So it really depends. Like at our school, if you're being mistreated, you can report it and, you know, hopefully get it resolved. I really think it just depends on who you work with. I haven't seen anything, you know, the people I work with are really nice, but I'm sure it does happen. And I know in the past it has happened, but everyone's case is different. You know, there are thousands of residents all over the place. Do doctors have relationships with people they meet in the hospital? Okay, so I'm just gonna start by saying this. Med students, residents, and doctors should never, ever date a patient. It's extremely unethical, so please know that a doctor will not date you. It's just really inappropriate and it can get any of us in a lot of trouble. So that's one thing that's off limits, but we can date each other. So like medical students can date other medical students. You know, I've gone on dates with medical students, had little flings. I have plenty of classmates who are dating each other who will probably match together. If you want, like if let's say I was in a relationship with someone as a fourth year med student, we could both match together to try to go to the same city for residency. So there's that. Like, yeah, a lot of doctors date other doctors. And, you know, for me, like, if I were to date a resident, it would be inappropriate if that resident was grading me or if that resident was, like, in charge of me. Like, that's, like, probably unethical and could get me in trouble. But I'm sure I could date, like, a random resident or something. And, yeah, residents definitely do date each other. It happens. Doctors can also date nurses. I mean, it happens. It's just, like, you gotta stay, like, ethical, you know what I mean? You don't want to be like inappropriate at work and stuff. Which leads me to my next question. Have you ever heard or seen people having sex in the hospital? No, I have not, and I think that's very inappropriate. And I'm gonna be honest with you, do I think it happens? It wouldn't shock me. I mean, you know, there's thousands and thousands of people who work in hospitals and you're kind of responsible for what you do yourself. You know, you do have like a little bit of downtime here and there, but it's really inappropriate and you shouldn't. You know, that's not like very ethical at all. I've never heard of it, never seen it. So, but I'll be honest with you, I'm sure it happens. Not promoting it, but I'm sure it does happen. Is there a lot of drama in the hospital? Now, yeah, I mean, there is a lot of drama, but I think the drama may be like, it's an emergency and we have to like rush and do something. I'm sure there's drama between people, like between coworkers and residents and nurses, but I don't really see it very much. I don't partake in it. One, because I'm a student and I don't want to get in trouble because that's like unprofessional. And two, I mean, what's the point? You know, I rotate throughout different like specialties and stuff, so I don't really get to know people very long. And I don't really want to be like high schooler anymore. I would say the kind of drama we have is like all of a sudden like an emergency happens and we have to go rush and, you know, help it. There's something called Code Blue where if someone collapses, we have to go and, you know, run quickly and help like perform CPR. Like that is dramatic-ish, but it's also very serious and like, yeah, I don't look at it as like necessarily drama. It's more of like emergencies. Do you make a lot of friends with people you work with? Yeah, honestly, I've made some good friends, some people that I really enjoy being with. You know, there are residents that I work for that like are grading me and stuff, and it's kind of weird because it's like I almost want to be their friends because they're really nice. But at the end of the day, like I try to keep that relationship separate. So I'm kind of new to it also, so I don't really know. But I've made many friends with classmates, with other workers. I haven't really hung out with anyone outside of work, but yeah, people make a lot of friends with each other and stuff. It's very common. Do doctors talk about their personal life while they're doing procedures or surgery? Not that I've seen. All the surgeons I've seen, like, they're pretty serious and like focused. Sometimes if like part of a procedure will slow down, like it's sewing or suturing, you know, we might have like little like comments or like little side conversations, but not really. You know, a lot of the surgeons are very focused. Do doctors have a lot of friends outside of work? Yeah, I would say doctors have friends outside of work, but you know, it just depends on the person. I have like my handful of friends outside of school, but I'm not gonna lie, I'm pretty engulfed in school, and it is my life for sure. In the show, the nurses rarely interact with the doctors. Is that how it is in real life? You know, I would say that we get to talk to the nurses quite a bit. Not super long because we're doing our jobs and they're doing their jobs. It really just depends on where you are and like what the dynamic is of the team. But medicine in general is a team, so we like to be inclusive of everyone, you know, including the technicians and even like the people who clean and stuff, you know, being nice and saying hi, just because we're all humans, you know, and it just makes everything easier when you're not like a snob. Do doctors perform long surgeries in real life? So I haven't done my surgery rotation, but yes, doctors do perform very long surgeries. I give them a lot of credit. Surgeons are incredible. OB-GYN doctors do tons of surgery, and they, you know, spend hours in the OR and taking out organs and doing different things. So yeah, surgeries are very long, and props to surgeons who can do it. Do people always leave the hospital in normal clothes? Okay, so I'm assuming that means like you change in like a locker room or something before you leave. Yeah, so I live like a 5-10 minute walk from my hospital, so I walk back in my scrubs. I think that's normal. I've Ubered back in my white coat before, but I would never go out to like the grocery store or something like that wearing my white coat. That's like weird. If anything, I'll just take off my coat and have like, you know, my outfit underneath on, or I'll change if I'm wearing scrubs, because like I think that's weird. If I go into like the OR and I have like stains on my scrubs, which you usually don't because you have protection, then yeah, I will definitely change my scrubs. I think that's kind of gross. And it's also like, you know, just a sanitary thing. So for us, what we can do is we can like put our scrubs in a machine, and then like our dirty scrubs in the machine, and then we can take out new scrubs, which is really nice because I don't want to wash scrubs all the time. I don't like doing laundry. All right, thank you all so much for watching. Feel free to comment down below what you think. If you think Grey's Anatomy is similar to the real world, I'm curious as well what you think. That was my perspective as a medical student, but everyone has a different experience. So yeah, if you like this video, feel free to please subscribe and check out my Instagram, future @Dr. Ryan, and have a great day. Thanks.